talks. I now invite Dr. Aditya to come and take over.
Thank you, Shruti. I think you put a very nice platform for this IC. Yeah, is that good? Okay. So I'm going to talk about lifestyle matters, update on environmental risk factors for myopia. So basically pluses we can do to reduce the minus. So as a pediatric ophthalmologist with an interest in myopia, as well as being a father of two young children, 3.5 and 18-month-old, in Delhi, I'm actually quite aware of the need to monitor actively and manage the visual experience of a young child to reduce the risk of onset and the progression of myopia. So let's examine the evidence and consider the conditions, modifications that optimize visual health and reduce the risk of myopia. So it is a big problem. In the 21st century, myopia is now a public health issue, as Shruti has already pointed out. Both incidence and prevalence of myopia is high and rising globally. And recent work from Sydney estimates that prevalence of myopia will increase worldwide. That is almost every second child. That 50% of the world population by 2050 should be myopic. And I'm pretty sure COVID has played a more important bungee here. So prevalence of myopia is already 80 to 90% for young adults between the age of 17 to 18 years in many East and Southeast Asian countries. That's where we are. But more importantly, myopia is beginning to be seen at earlier ages than before. Myopia has been reported in children as young as 4 to 6 years of age, resulting in more years spent in progression mode and therefore higher net myopia. This is crucial to prevent onset of myopia, and if not, to intervene at the earliest possible age to reduce the risk of progression. That's what we plan to do. And the economic burden is staggering, 202 billion per annum, and by 2050 this should almost become 4 times. And increased myopia comes with increased pathological myopia, which itself can lead to blindness, and we know that environmental interventions can reduce this, so why not? This is the medical burden of myopia. I'm pretty sure we've all seen these in our OPDs. A lot of prevalence studies, especially from Southeast Asia, has shown, and this is a little figure I like to show, which talks about how it's going to progress in different countries. So if we're not already scared, we should be. We've also done a study ourselves called They See They Learn about prevalence, which is going to come about Delhi, which compares the pre-COVID and now the post-COVID work is being done. So myopia is a multifactorial in origin, both genetic and environmental factors, something that Shruti told us about. There is a clear link between myopia and environmental factors like near work, age at which the education school started, years of schooling, time spent outdoors, lifestyle factors like housing type. So even where you live has a role to play. Urban versus rural living spaces with one or more of the factors involved in the current myopic epidemic. And this knowledge also provides us with an opportunity to reduce the risk, like including changing your house. That's something you should think about. As well as progression of myopia through modification of environmental risk factors like near work and outdoor activity. So are we, by telling our kids study more, doing them a favor? In examining the evidence more closely, greater amounts of time spent outdoors is associated with reduced risk of myopic genesis and progression. Similarly, less myopia and better uncorrected visual acuity has been reported in children in China who spent 30 to 60 minutes, more than 60 minutes, doing outdoor activity during midday. So outdoor activity really has a good impact. So is it becoming fast more of an environmental epidemic than a genetic or family problem? I'm afraid so. Two factors that make us Southeast Asian countries a hub for includes our intensive schooling and lack of outdoor play. which we as parents do promote. So environmental risk factors were evaluated using a questionnaire in this study, and they were calculated using backward regression analysis, genetic scores, and everything pointed down to the fact that the study that the myopic progression is a combination of both these environmental adjustment of lifestyle, and this needs to be looked at. What about outdoor play? A number of factors associated with outdoors, such as increased light, spectral composition of outdoor light, a flatter dioptric world, reduced pupil size with improved depth of field, and increased secretion of neurotransmitters like dopamine all play a role. In this respect, it appears the bright light has a role to play. And data from animal studies reported in this article shows just that. Furthermore, daily exposure to outdoor light of 3000 lux or more has been shown to reduce the axil length growth in Australian children in this study, and that itself works better than myopia or any other medical role. So season 2 has a role to play. Did everybody know this? There's a very nice article which came out which talks about how it's slower in summer than in winter. So I'm pretty sure we all are booking our tickets with our children to Australia for our winter vacations. And light intensity also matters. So housing and architecture of the school, does it have a place? Although not fully explored, a study has shown, both in China and Australia, which talks about children living in urban areas having higher level, especially more those in apartment residency, confined houses, terrace houses. And they found out that the more the open spaces around the housing, the better they do. And additionally, improved lighting has a factor in these houses. So this is another study which basically talks about outdoor activity being better for the child and the myopic progression. So the association between near work and activities in myopia, this is one of the largest studies about that. And they said the odds of becoming myopic increases 2% with every dioptric hour of near work per week. And the near work categorized as risk factors includes reading, computer use, video games, and other near activities that the child does. More near work leads to visual experience that is hyperopic defocus, which Shruti talked about, due to accommodative dysfunction or lag. And hyperopic defocus signals are considered to be a signal for the eye to grow in length. So it's very, very important that outdoor activities have to be balanced along with your near work. So these are various little chart I made about how myopia progression happens with what type of near work that they do, and including 2 books per week, which makes it 3 times more likely to be higher myopic. So education toll, early schooling has become strenuous, higher achievements are always looked for, and then now education doesn't stop till you're very, very old, doesn't it? So all leads to myopia. Parental myopia is something that we all know has a factor. A lot of studies have supported it. What about peripheral refractive rays? What has COVID done? COVID and the lockdown effect pretty much show what we asked them to do was go out, go green, reduce screen time, avoid dim light exposure, UV and vitamin D therapy. But now what has happened, we're telling them to stay indoors, go screen, everything is online. Increased screen time, reading distance is now becoming closer and closer. Children are more prone to phones and laptops than even television, and no sunlight exposure has happened. Screen time, something that we have to yet talk about. So screen time can't be avoided post-COVID, but it has led to increased in risk in progression of myopia. And also mental health. We don't talk about mental health. Stress, anxiety, loss of social skill, behavioral changes, impaired cognitive development in child is also happening. And various articles have come to put light on this. So the articles which have studied this, including ones in Lancet, have spoken about screen time results being variable and said more studies are needed. So we need further investigation on this. WHO is also recommended, I think something that we all can follow. So environmental factors play a large role. Various things we can do to fight this novel in our house, and the ancient wisdom. Go out, play, and our jobs as ophthalmologists is to put it out there for all of our patients to understand, put these posters in our OPD, make them aware by counseling them, talking to them about environmental factors and how it's going to benefit them. And something that is often asked, how do I reduce my glass power? So improve access to natural light, improve outdoor time, delay introduction of screens in young children is what I recommend for my children and all my patients, and I would hope you all do so. Thank you. These are my teachers. Thank you so much. And I hope you all enjoy your frisbees with your children.
Is there something like some people advocate exercise and things like that for myopia? You people are exercise, eye exercise and things. Some doctors suggest that. Is it something like that? Is it?
So something that I have a very simple way of answering is that I don't discourage anything that, but I also say there's no scientific benefit for doing that eye yoga that people suggest. Nothing that in scientific literature has promoted it, but there's no reason to discourage something which won't harm the child. So unless the time taken is outdoors, I said just do whatever you want, do it outdoors.
Placebo effect. That's what